He is a former sports physio for Tamil Nadu and Himachal Pradesh football teams, associate medical director for Chennai FC in the year 2014 and 15, and he also worked with Chennai Smashers Pro Badminton League. So it's a pleasure to have you for the session, sir. So we have coaches from Pan India, Delhi, Lucknow, Chennai, Bangalore, Madurai, and anything which I missed out? Noida, Hyderabad. So we all train the students from the underprivileged communities and who are basically poor. They cannot afford much towards the sporting gears, infrastructure, and high coaching fees. So they are all, our mission is one, but everybody has a different, our own way of executing the program. So we want your guidance and advice when it comes to preventing the injuries in the sports. Over to you, sir.
Good evening. I'm Raghunath Monogaran. So I'm also happy here. I've also started my career from a small sports academy in Chennai. That is basic for the underprivileged kids. So my career started from there only. You go to some Chennai, I think so. Chennai, I know them in the marketing. Right. Okay, I started my career from football. Still I'm in football only. So the academy called Disha Sports Academy. So I started my career there. The kids are underprivileged from boxing, football and athletics. So I also started my career from there only. Then I traveled a lot, and now I'm owning my own rehab center. So about myself, and today we are going to discuss about injury prevention. Okay. I think the common thing. So I'm not very Suttama, I don't know Hindi. Don't mistake me. I can speak in English. So if you have any doubt,
you can.
So the translator there in
I will
Hindi.
try to translate.
So I can manage the Telugu, Kannada, Tamil and all. Not speaking, I can understand. So another thing is I'm very happy the injury prevention for grassroots coach. So I love grassroots coaches because for that purpose I started my own academy in Chennai. I have a boxing, football and skating academy in Chennai for grassroots children because the major role plays the grassroots coaches. Okay. Like sir is there, HCL on B candidate after completion he comes here, no, they can mold easily. For LKG kids, the teacher role is very important. So the grassroots is very important. So for grassroots coaches, you want to know many things compared to the senior team coaches. The senior team coaches knows everything, but the grassroots coaches want to know about the medical part. The only the skill can't help. Understood? Very good. It's not a negative thought. Many parents, they are training their kids, they spend a lot of money and they concentrate more on skill. The true coach can tell with the skill, the kid can success, not possible. So we have diet, we have fitness, we have psychology. So everything together only the kid can success. So once they go for elite level, senior team level, this all helps them. So today the part is the injury prevention. I'm going to tell about injury prevention. So before that, I'm going to next slide. Next slide. See some few outline I'll tell you about the injury preventions. What are so why the injury prevention is very important? Anybody? You can use your own language.
Perform better in particular sports.
Then
Safety.
Then
Play safe. Play safe. Very
safe.
good.
Then
Play for longer time.
To play for longer time.
Longer time. Yeah.
Over years.
The important some means after.
Prevention is better than cure.
Yeah. Good.
Very good.
So some things important meat. You are going to train your kid like 100% effort. You want to train. You want to train for some meet, important meet. In that meet, if he got injured, what will happen? It's a major injury. For example, fracture or ligament tear, knee ACL tear, boxer, shoulder tear, shoulder ligament tear, supraspinal muscle tear. Something happens, what will happen? The 6 month, minimum 6 month, 4 months, 6 months, 8 months, gone.
Right.
Right. Then again, what will happen in this 6 months? All the fitness gone,
Yes, gone.
skill gone, everything gone. So that's the first point I told. Together only we can make a athlete, a strong athlete. So dietitian role is very important, psychologist role is important, strength and conditioning role is important. And we are very happy, like after 2016-17, in India also we got a team. After IPL, ISL, Pro Kabaddi, all once comes, no, you can see the bench, official bench. Before 2014, we have only 2-3 officials visiting the bench.
Right.
Coach, assistant coach, manager. That's now you can see 15, minimum 15 professional team.
Proper physio.
2 physios, sports medicine consultant, and dietitian, sports manager, strength and conditioning coaches, sports psychologists.
Totally different.
Totally different. So in this part, as a grassroots coaches, you want to know which all part is very, very important in make the to prevent the injuries. So next slide also. No, next. See, first part I want to tell about this is very, very major important thing. We don't touch. Nobody will touch. So mind your posture. You know what is the posture? Any model, men model. What is more t-shirt?
Volunteers.
Trousers.
Volunteers.
Everyone are from
Yes,
sports.
sir.
I
Come.
don't believe that.
इधर
See,
Pay attention, guys.
so I want to show what the difference in come this side.
So you want the lights to be switched off?
So I can put light. Mind this light can be visible.
Let's see.
Yeah, I know. Can you switch off this?
Yes.
What is the reason we need to take care of the posture? What is going to be, how can you prevent the injury? See, in each, can stand few minutes. Okay. In early stage of bone, we have each age, we have the oscillation of the bone. Oscillation bone is bone growth. If you born, immediately not, bone growth is not finished. 5 years, 6 years, 8 years, 11 years, 15 years, oscillation is there, then it will complete. So same thing, early childhood, the child from 3 to 5 years or 4 years, if we find some deformity like posture deformity is there, we can correct it. It is possible. So we have an angle, that all a detailed class, we have an angle called for all the bony part. With that angle, if there is no any bony involvement, so we can make the correction with a strengthening protocol. So this is very, very important to the coaches. So first, from head to toe, I'm going to tell you. Okay, from head, the head should be nowadays 90% all the neck forward. Reason? Mobile phone, computer, TV. The kids 6 years, 7 years also. They're watching in the sofa, everything. So the neck should be very straight. Your tip should be with the shoulder tip. That is the right posture for the neck. Okay. Then see this posture. This is a good posture. That's standing straight. This we called forward bend. This is kyphosis. Okay. This will be bend. So he is a good posture. And the third one is inside. this we call lordosis. Okay, and another thing is we call scoliosis, the S type. That also can correct without surgery in initial stage of the degree, the proper assessment. If the degree goes more than angle, we can't do anything, we won't go for surgery. Okay, then the shoulder should be, he is having a rounded shoulder. The shoulder should be like this. Okay, then hip. So the great good example, I forgot sir name. Nandagopal is another problem. So the leg length. So you can see his walking pattern. If you are a medical person like a physiotherapist or a doctor, you can easily find it. His gait, walking is a gait pattern. Gait is not good. Okay. So come to the point, the hip. The hip you can touch both the bone. Front bone you can touch. You can feel. You can feel. Front two bones will be there. You can feel the hip bone. Same back side.
Yes.
Okay. You can have a thread or rope. You can keep straight. The bone is straight. That is a good posture. So most of 60% will have deformity. That is a mild deformity. That we can make as a correction, strengthening correction. It is called pelvic tilt. So we call anterior, posterior, lot of names are there. That tilt can be corrected. Okay. I'm fast. Okay. Then this knee is a bone deformity. We call bow leg and knock knee. You can see people walking like this and walking like this. Kids stage, if you find, we can make correction. So kids, you want to assess all this. If you are going to train a kid properly, you want to have at least one physiotherapist for assessment for your kids training. So he will make assessment and tell you. So another point, we can't train all the kids together. So like a school, one kid will be weak in the skill, one in the fitness, like one in this problem, so he can't perform. So this is a very, very important role to posture. Okay, so the knee is very, very important. The next page. So I want to show you the spine. So he is good. He is good. Because he deserves a good abdomen. Yeah, mild abdomen. Okay, go back.
Thank you very
Thank
much.
you. Thank you.
Any doubts?
See, if the child starts more, you can initially can't diagnose a bowel at the age of 2 or 2.5. After 2.5, it starts walking with 3.5, 4 you can diagnose. Okay. If the degree of the angle, we have that's a detail. Okay. So we know the degree of the angle that is possible. We can immediately start the strengthening protocol to correct it. Some bony alignment is that not possible, we need to go for surgery. So in the age of 3+, you can start. If you have a teenage, you are going to find out age after 15, 16, that you want to go for surgery only. 70% surgery only. 40% we have chances, same degree we can make it. Okay. So next important thing is foot. Calf. Not only flat foot. Our ankle is very important. We don't bother. We wear a good t-shirt. We wear good innerwear. But we don't bother about our shoes. And our foot. Kaal eppadi irukku, how the foot is there. We don't bother. That is very, very, very important. For general people also. Everybody will take their back, shoulder. People comes to my clinic, I will check only the major thing is the foot. Then ask, I came with back pain, why you want to go for my foot assessment? We are talking about the foot. Because we are going to use, yeah? You want to explain in Hindi? Want any Hindi? No. Okay. I'm also bad English only, so you can understand easily. We all speak bad English. Same, North Indian, South Indian, we all speak bad English. So we can under adjustment, we can have adjustment. So why we need to take care of the food? Abhi kya paaka? Reason. Because we are going to use our food daily. Without food, you are going to, without using your food, you can be survive? No. Your full body weight going to be in the food. Okay. And your body weight should be there bilateral. Your normal weight, for example, your weight is 40 kg, 70 kg. You want to make your weight back 35. Or mostly we don't do it like that. For standing, you put 70, 60, like 50 here, 20 here. That all makes a problem. Next, the problem is your arches. So now itself, immediately you all can remove your shoes and check. Dirty socks means don't remove. Otherwise you can remove. You can remove. You can check. I can tell you. You have eye arch, you have a flat foot, or your normal arch. See, the image is there. You can stand and see. Where are we there? You can stand and see. You can check. You can check. The image is there. So this is very, very important for the kids. Take a paper,
Okay. Since everyone is from sports background, I doubt anyone has a flat foot. It will be very rare. So we found one candidate. We haven't Challenge. How much is this? 1, 2, 3. How much is this? Everyone, I'm asking. 0. 2. 0. Say it. 4. 0. 1. Pay attention.
Okay. See the image. The first one is eye arch, second is a normal arch, and third is flat foot. See your toe and your heel should be touch the floor. So he asked some question. If we have eye arch, it's a problem. Yes, it's a problem. You're going to get an impact in the knee. Okay. So you have flat foot also get impact in the knee. So now we are going to go for your 6th standard class. Center of gravity, line of gravity. Okay. So body we have center of gravity, line of gravity. Okay. So that center of gravity, line of gravity, we need to see our body. You want to see flat foot? See our flat foot. After the class also you can. One leg. And she have a problem. Alice Congress. She is using a more cut shoes. What are cut shoes? What is the problem? Alice Congress, no? The great toe inside. Football players are because of boot. So we can make. If you are going to have Alice Congress problem, football players also will get a pain. Where? Chair. Okay, you can keep your board is there. Board is there.
Board.
There's a board.
You can write.
See this region, no? The bone. Here. You get a pain here. Okay. This is not a fact. This is a problem for allergy. So this should be straight. So we can make correction. We have a brace and we can correct it. For football players also. Kai got a problem. Okay. So this region, no, you get a severe pain. Bone. Okay, the finger goes inside, the greater goes inside the pain. Okay, this is a arch issues. Okay, you can see. And next one, this also, this problem, excuse me.
Yes.
This problem you can see for athletes. The athletes and jumpers, basketball, volleyball, we can see this problem. This problem called inversion, pronation, supination. Your legs will be, when standing, your load will be go like this. One leg will go like this. Some people will inside. So automatically you get a pain in the back of the shin here. Okay, the leg back side you get a pain. Here we call Achilles tendon will come. That is like a ligament, not like a muscle. It's most of the athletes will come this pain because of the shoes and wrong pattern. And kids always plays in the mud ground. In India, we don't have a grass and synthetic turf. So you will get a show this problem. So unfortunately, we can't search athletic like synthetic track and grass ground. We can take care of the shoes. Okay. Economically, we can have everything nowadays. You don't want to worry about the financial part. Economically, we can do. In 2010, only few physiotherapists are there sports. Now a lot of physiotherapists are there. So you can easily assess cheap also. Physio.
Yes, sir, like she's having flat foot. One of my students is also having flat foot. So what should we do?
Yeah, I'll come to that point also. After this, I'll come to this. So this happened to the overload. This happened to the overload. Improper standing or running, this may affect. Okay. Because for this all, I'll give a solution for you. Don't worry. So next slide. Solution means what we can do. I'll tell you what we can do. Okay. See. First of all, two things you can take care. First one thing is the ground. That is not possible some places. Second thing is your kids' shoes. Size and insoles, and the quality of the rubber that coaches can take care. Third thing is the proper insoles. So for these questions, for adult, we can have we can't make a normal leg. Okay. So we can have some exercises to bring some light curve with proper arches. Now India market, previously I also suggest ready-made insoles. Okay, if you go shop you can get flat foot, but nowadays I don't suggest ready-made insoles because the kids or athletes have a problem with the flat foot, they have a problem of supination also. So for that we don't get a ready-made insoles. So nowadays we are getting a customized insoles. Many things are cheaper also there. Okay. So we need to make a foot assessment. I do the foot assessment. The machine tells the proper result. What the foot is having issues. Then we will do a customized insole like this. The raw material will be there. For your leg, we will do the customized. That will correct your supination and flat foot. Plus, this is 70%. 30% you need to take care of your leg muscles. Leg muscles, which all muscles, that's a physiotherapist. Which all muscles weak, which all muscles tight, we will correct and we will make a strengthening protocol. That also helps a lot. What?
It's a long process.
Not long process, which will depend upon the condition, the range is available. Yes.
Is this facility available at every places or only in Chennai?
No sir, that's like nowadays we are getting everywhere. See, I was taking a workshop for physiotherapist in 2000, from 2009. 9-10 years is different now. Now north side is developed a lot. We have visited Bihar, Orissa, Bhubaneswar, all cities all we reached. Assam, Ceylon, all we reached. All the advanced treatment sports facilities. So you are getting there. So you can check. So this is the first major role you want to understand about the posture. And I'll go previously about your spine and your hips, everything. For leg length problem, for example, Sarah is having a 1 inch leg length. See, for leg length difference, we measure in a centimeter. If you have 0.5 centimeter, not issue. So 1 centimeter, 2 centimeters, we'll check the full assessment. Sometimes the hip muscle tightness may cause the difference. So we will adjust. So 1 centimeter reduce automatically. Balance 1 centimeter, we give a insoles or something adjustment to come to a normal hip level. Why? Otherwise, spine back pain will come. So why I am telling everything this to you? Without correction this, the player can't perform. If you want like under meter runner, we have shoulder issues or spine. You are, I don't know about technically, you have some technical strings, everything, right? That time you can't shoulder, one is depression, one is elevation, up and down, the performance will be less. So you can't. The spine, kyphosis, he can't speed. It's all, that's only I'm concentrating more on posture. You want to ask me?
Does this reflect in knee injuries also?
First of all,
I have a lateral cracking in my knee.
yeah. First of all, why I'm talking about more and more the ankle and foot, no? That's what I told line of gravity center. You know, this will go for knee pain, automatically back pain, and aggravate everything.
And automatically it will reduce the performance.
Yeah.
That is the main thing.
That's what I'm telling you. Performance coach, what we need to do. So we need to correct it, make the strengthening. That's all. Now, sports physiotherapy is very challenging previous year. Now we have strength and conditioning. See, I go to state team now. I will take their dietitian role, sports physiotherapist, strength and conditioning fitness, kit manager, kit man, my 3 bags. Nowadays we have strength and conditioning. We have sports nutrition. Previously we don't have sports nutrition, only general nutrition. We have sports nutrition. We have sports psychologists. The player can perform. I treat many conditions. That player, everything is fine. Coach will come and shout to me. He is not performing. Why? Everything is fine, fully fit. But problem psychology. If you give a counseling, 1 or 2 sittings, no, you'll go. The fear will be there, the pain fear. That's happened. So this is very, very, very important in the posture. So next slide. Yeah. Next thing, you know, everybody you know, we need to concentrate about the muscle strength. Okay, muscle strengthen and muscle flexibility. It's very, very important. And the warm up and cool down also is very, very important. Actually, previous coaches or many kids academies know they do. Kids play, the cool down occur. They will directly run away. So that we need to maintain the body temperature. So cool down and warm up is very, very, very important. So the muscle strengthening also very, very important. So how many coaches will give a weight training for kids? Age.
What age?
What age?
What age kids?
Not regularly, but 2 days a week. We are going with about 17, 18, 19.
17.
18 years.
Below 15, below 14.
Not
Below 15, anybody giving weight training?
well, if it's not the weight training, more of making strong their muscles.
Then how will
Body weight training.
say I have a doubt. So I have a doubt. I'm not a graphic coach. Okay, so I'm not going to train the kids. I have a doubt. Below 14 years kids, how are you going to improve your muscle strength and muscle tones everything?
Sir, without equipment, we can run some outdoor sessions like fitness, like squat, push-ups, some running, and
Self body weight training.
Own body.
relevant. But we avoid to use gym equipment below 14 years old.
So we need a proper strength and conditioning like a schedule. So like a training schedule, kids also can plan the proper
2 days a week.
Yeah. So how many coaches will give hydrotherapy for your kids? Water therapy.
Water.
Water.
Ice bath.
Water.
No,
That's a cryo.
ask him to go for a swim, performing ABCDs of running.
Like we are working in that kind of area where we don't have a swimming pool and this kind of facilities.
Small lake.
No, there, nothing.
So how many of them giving water therapy? Water therapy is not only swimming. We have strength training and recovery training in water therapy. Here are some activities. So you want to know that. Okay. So this topic we need one day class. Okay, we will request HCA next time. All thing one day. Okay. So we don't take what is water therapy, what all exercise we can do. That is a blue topic. So the muscle power. So you know neuro, that's same thing, neuromuscular training to provide injury prevention. You know neuromuscular training? So watching Ronaldo training in indoor stadium, watching athletes, some athletes, famous athletes, Usain Bolt. You consider only after 15 or 16 only gym training, weight training is going to help the performance. So we call neuromuscular training. It's a nerve muscular training. That is comes under the agility. So coordination, all the agility will come. Coordination, balancing, agility, all comes with the neuromuscular training program. So first point is improve our balance, improve strength, and improve agility. This all comes under the neuromuscular agility training. And muscular flexibility. The stretching is very, very important. My son is 6 years. I started from 4 years, 3.5 years. I started for 3.5 years for flexibility. Football. I'm giving proper flexibility. So football is going simultaneously swimming to improve your muscular strength and muscular endurance and recovery. So that is very, very, this both part is very, very important. Muscle strength, the neuromuscular training, agility and flexibility. Next slide. And I'm not a dietitian, but I want to give some tips for diet. Okay. So importance of nutrition in sports injury prevention. Do you have any dietitian part this 2-3 days?
I am only taking.
You only taking?
Yeah.
Okay. So I think detailed Sam will give. What diet, before training, after training, and before match, how many hours. So that's all we need experience. Take 1 hour session. Then you can take, right? So the proper first part thing I want to tell you about hydration. So how we monitor the hydration part? Your kids.
We give them a regular break during the practice and trying to engage, drink salted and.
So see, first of all, I don't want to compare. You're going to give a training for underprivileged children and well-off children different. You're going to give a training for children.
Right.
Okay.
But I'm just talking about that part only when you're talking about the swimming and water pools. We don't have that facility in that area. We can't afford that injury prevention session at water.
Okay. That I'll tell you some ideas.
Definitely, sir. We are.
Okay. We can get a 1,500 rupees if possible. That I don't know. It's possible for you. You can buy a square drum. Okay, for kids. We have a small square rectangular drums available for kids. That is a 3 feet. You can fill a water. You can eat two people. You can give a recovery. You can give a water therapy. They don't know to swim. We have exercises. Water therapy exercises there. We can give that. They can also enjoy. Another part. You want to have a note. If you're going to start a training for your kids, you are the coach. In India, no, we will tell that I don't have this. I don't have this. Not possible. We can't do anything. That is very bad attitude. We can do, it is possible. We need to have a checklist before training. You have 10 kids, for example, you are athletic or something. What all should be there in the ground? Only coach, huh? What all should be there in the ground? Here afterwards, once you go back, no, you should follow this.
First aid.
First aid.
Equipments for the training.
Training, yeah.
Some TheraBands or resistance bands.
Yeah.
Electrol and water bottle.
Electrol is not possible. Water. What we will do? Kids will bring.
Ice box, put some ice.
Yeah. So we need to suggest kids to bring minimum 1 liter water bottle. If possible, we can arrange the water. Water is important, ice is important, basic first aid. Open wound, ointment, sprays, that is really important. Okay, so that should be you want to keep. Then only equipments. So the foreign coaches comes, they don't start the training. Without water,
Ice box and
they don't start.
they don't start.
That is very, very mandatory. We need that you want to maintain. That's a professional coach. Okay. So the main part for the diet, the hydration is very, very important. If you don't hydrate properly, what will happen? Okay. Don't hydrate properly, what will happen?
Cramps.
Cramps and you can't perform well on the ground during practice.
Cramps.
Yeah.
They'll get tired easily. Major problem cramps. It stoves. Okay. And other parts, so eat sufficient carbohydrate and protein diet. There's again I'm telling you, it's a nutrition part. We can't give a diet, every kid's same diet pattern.
Depend according to the body.
Our kids, underprivileged kids, you are telling you eat everything. They have more stamina.
Whatever they
The
want.
paid academy only we need to take care. Our kids will eat everything. They have more stamina. We go international pre-season and all, no?
Yeah, particular specific.
They'll ask many things. But the problem, no, for our kids, they don't know what to eat. Once the professionally they come.
Right.
That should be taught in craft. That I have experienced for my senior teams. So nowadays, young age, they want to eat everything okay. But they come once the tournament and professionally, as a grassroots coach, want to teach. Now, person meet ko na tao Chennai person yaar rakhi hai. Tamil. We go to Chennai, no. We go to somewhere last fish curry and rice. No, we have buffet. Nutrition part should not fill your stomach. What we need to do? We need to make a nutrition part. Diet is a nutrition. It's a wrong mistake from our mother. Childhood mother want what to do? Eat. Because they don't know. We all want only rice. They will not concentrate anything other vegetables and green leaves and all. It's a big mistake from our mother. Emotion. Rice only we have a carbohydrate. If you have a proper meal in the afternoon, we need to have you can take more vegetables, green leaf fishes. That makes multi vitamins. But what we South Indian especially do is no rice. North Indian do is potato. Chapati potato. That's all. They don't take anything. It's very, very missing. Only we are missing a performance.
The one said, what will you do with one roti? Take 5 more. 6 more.
Okay. So hydration and maximum take care of calcium and vitamin D intake. With calcium also very, very important to make your bone strong and includes healthy essential fats. So ramps up to our antioxidant is like pomegranate. Example, many things are there. I think tomorrow Sar will send a video for me. I will also learn nutrition. Okay, next. So next thing is coaches knows the like prevention sports equipment, the games. I watch most specifically football, no shin guard. Basketball. Our kids comes into the ground, they'll become a hero. They don't want the shin guard. They don't know about what will happen if shin bone gone.
Right.
If you got fracture in femur, thigh bone, femur, somewhere also you can make easy recovery. Shin bone, or recovery late. Easily it will have this multiple fracture, communicate fracture easily. Not a single fracture, 2-3 fractures, that will happen easily in shin. That's only they are placing a shin guard. But you don't follow. Training then. How many people are died during training, During training, they are collapsed. Training also is very, very important. So the very important things you want to take care of your equipments. So that helmet, gloves, everything is each sports we have some equipment. So I think last bench, I think it's going bored. I think good AC, good. Tired, huh? From morning.
So we have a question, sir.
Yeah.
How can we stop slouching?
I can understand.
In Inkosare.
So how can we stop slouching? Slouching means what is strategy for slouching?
What is that?
Slouching. Crouching.
Slouching.
Can you Hindi?
In which game?
వేరే అర్థం స్లౌచింగ్ అంటే ఏంటి అని అడుగుతారు.
బాడీ వంగడం కానీ ఇట్లా అవుతుంటాయి కదా ఎట్లా స్టాప్ చేయాలి?
How to prevent the crouch.
This one.
Yes.
So there is a shoulder and your back upper spine. So you have to concentrate more. You want to make your spine straight. See, it's a 90-degree position. That's what it is.
No, it's okay.
इधर क्यों कटा बोली जा? ये कटा बोल जा? Okay. See, you want to make a 90-degree position. Always want to sit straight. Some people have a kyphosis and rounded shoulder. So you always have to make your shoulder stand. You want to and you make for push-ups. You want to make your scapula muscle strengthen. You take poses like that. You make a push-ups. You make strength your brain. Strengthening the area. Next. What's the time?
5.
Okay, next is. So next is train, rest, recover. So rest is a major problem for the professional player also. This is a main thing, but professional player also will not take rest. They'll watch Premier League, they'll watch, we have tomorrow match, they'll watch.
This is the risk.
So that proper sleep is required. Next day, the high performance top games like basketball, football and all, we can see in the second half, player performance. Easily we can see from outside. So that maybe the diet or maybe injury, third is proper rest. Before they match or training, the player should have proper rest, sleep. The sleep is very important. All the micro organs and nerve stimulators very important. If they don't take proper sleep, it's very difficult to perform. Okay, and the training part also, the rest is very important. Okay, so this is a short thing. I think I finished in 35-40 minutes. I continue to know till board.
Yes, sir.
No, sir. Please really grateful knowledge for us if you can share more.
You can tell anything if you want.
Ask questions. Ask
Want
questions.
that?
Ask questions.
Shoulder pain. Like volleyball. It got me there in shoulder while smashing a ball.
See, please, a few questions, no, you can also listen. See, I charge, if you want a consultation, we charge 750. 750 rupees each consultation for 5 minutes. 750 rupees.
Now he is available, so please don't talk.
Why I'm telling
make
you,
use of him. That's what he's telling you.
Yeah, the thing is, he is asking shoulder problem. If you get the ideas, no, you can suggest. If you don't want to waste 750 rupees. Now sports physios are very expensive in India.
Yes.
I don't know about normal clinics because the sports physios are expensive now. So if you know basic first aid, you can treat your players, your kids. So first aid is, see many coaches also doing the treatment. I'm saying that's also wrong. First aid you can do. Wait for 24 hours. Next, kindly shift the kid to any major immediately. It's not a major, after 24 hours, shift to any general doctor, or sports physician or sports physician. Many orthopedicians are now doing sports medicine also. So few are there, so you can go to sports physio or sports medicine. Kindly send them, assess him initially. Why I'm telling you, initial stage treatment is easy. That is acute stage. Chronic is difficult. For example, ankle sprain. The kids play, injured, swelling will happen. They will go and take X-ray, no fracture, they will live it. But ligament injury is there. So if you not take care now, after 2 months they will come. What will happen? The pain will be there next 6 months. If you come acute, you can easily recover. Same, another thing is there. The doctors need to take blood investigation, simply MRI, simply X-ray. You don't bother blood investigation. If any soft tissue injuries happen for the kids or adults, kindly, if investigation is required, do initially. Either X-ray or MRI. We can diagnose easily. We don't waste the time. We can assess. We can treat initially. So the return to the sports is very easy. We have a topic called return to sports. One seminar is there. That seminar is 2 hours. That return to sports. After injury, the player can return to the sports. The shoulder problem. So I can't tell what is the shoulder problem. Shoulder may have some arthritis. Two bones are there. Arthritis, rotator cuff. All 4 muscles are there. Tab may be there. Ligament tab may be there. Dislocation, subluxation, lot of issues there. So basketball player, volleyball player, they commonly have.
Sir, kabaddi players அவனுக்கு எப்பவுமே ஷோல்டர் இறங்கிடும். ஷோல்டர் டிஸ்க் இறங்கிடும். எப்பவுமே எண்ணி மேட்ச் சொல்றாலே அவனுக்கு இறங்கிட்டு திருப்பி அவனை அட்ஜஸ்ட் பண்ணி அடுத்து வச்சு.
So he is asking that kabaddi player is having irregular subluxation. Like shoulders coming, dislocation. It's called recurrent subluxation. We call recurrent subluxation. அடிக்கடி ஆயிட்டே இருக்கும். அது we should not leave it. If you going to leave it, go life is going on. நீங்க கம்பேர் பண்ணலாம். You compare the both shoulder. That injured shoulder will go for muscle weakness. ஆயிட்டே இருக்கும். இருக்கு. நீங்க அதுதான் இனிஷியலா நம்ம அசஸ் இப்ப இதே லேட்டர். You need to diagnose and yes sir. You diagnose immediately want to go for a scanning.
What is that?
Sir, no doubt, sir. One second.
Basically, in basketball, the major part of the body is the ankle. So what we should avoid ankle injuries, the major part of the body.
So one thing is,
Strength of the ankle.
first thing is make a proper shoes, good quality shoes, make a good assessment and make a good arch, and all the muscles should be diagnosed, assessed by a physiotherapist. Any problem is there. Next reduce the pain. Next strengthening. The strengthening will take minimum 12 weeks, maximum 20 weeks. You need to wait. Strengthening. So if you want to follow a sports physiotherapist, we need to follow the fitness of the sports physiotherapist. Many people what they will do now, they will come for the treatment in the ACL surgery. They will not wait for 6 months. We don't bother. They will start to play 3 months, 3rd month, 4th month. After 2 years they will come. That we know. நான் சொல்றேன்
50 மீட்டர் மெஷர்மெண்ட் டேட்டா அது அதர் 50 மீட்டர் மதர் டேட்டா
பேக் சைட் டை பேக் சைட்
ஒன் கால் மாத்திர அதே பேஸ்
Only one leg.
So this his complaint is he have a thigh problem in the back thigh problem. Okay. Hamstring muscle. There is a hamstring muscle. So we need to take care first your hip. Hip is right or not. And hip muscles. It's either hip muscles or stiffness. Third thing is your hydration part. That is we call sodium, potassium, magnesium, etc. That level will check. That is good or not. Then your flexibility. Then your front thigh muscle strength. If that front thigh muscle not strength, this muscle will have a problem. Same thing. If you have a problem in the hamstring, kindly don't repeat the sports. You're going to miss a 6-month sports. It's not just a muscle. Same like a ligament. Hamstring injury aachna, don't take easy. You want to treat immediately. Follow the doctor or physiotherapist, anybody. Wait till the recovery and go. Because that is a major speed muscle. That's called speed muscle. If you want to start instant speed, the muscle active. If you go not give a proper recovery time and treatment and strengthening, not go. You will be easy.
அப்படியே நம்ம ஸ்போர்ட்ஸ் எல்லாம் போஸ்ட் ட்ரைனிங் வந்து செல்லிங் ஆயிடும் அடிப்பட்டு ஓடிடும் அப்ளை பண்ணுமா இல்ல
we have price technique. அதுதான் ஒரு price no technique இருக்கு. நீங்க அடிபட்ட உடனே ஒரு பிளேயர் வந்து எப்பவுமே see is ask good thing no first aid any injury
Note it down, this one actually.
it's a first aid. Any injury should not make your the player to be disturbed. He may be a fracture in the neck or spine or anywhere. First don't move. First what problem? This is the first aid coaches can do. நீ சொல்றீங்கல for example கால் கேட்டிங்க நாட்டு கேட்டிங்க கேட்டிங்க for example shoulder is happen. Don't move. I saw like we have a movie in Tamil Gilli. Our star superstar Vijay is there. Movie la paathu ellarum enna பண்றாங்க and அதே மாதிரி நிறைய கேஸ் எனக்கு கால் 5 மணிக்கு ஃபோன் பண்ணி வந்து பாத்துறாங்க
அவர் பாலிவுட் தான் இட்டு இருக்கு அப்படியே போயிட்டாரு.
So what happened no? Some same goalkeeper what will tell some goalkeeper that I got a finger injury. Hey எனக்கு இத நான் அடுத்து இழுத்து விட்டார். The finger got dislocated. Nobody is coming. அவருக்கானது வேற ப்ராப்ளம் இவருக்கானது வேற ப்ராப்ளம் இந்த மாதிரி எது சொல்ல வரணும் why am telling no different problem is there. So like we should not first thing is we should not move. First save the joint, shoulder or back or hamstring. First save the joint. அதுக்கப்புறம் ஐஸ் வைங்க. Okay, let's call price technique. Okay,
Rice or price?
No, price.
price is the advance, price is the old.
Who can tell what is R? I?
compression
Elevation and elevation. The first
Actually, is the problem, sir.
if you don't want to do like ICE கூட தேவையில்லை. First kindly do R. அதுதான் பண்ண மாட்டேன் யாருமே. Nobody will do R. Main thing is R. That is the rest and the joint, whichever the point, joint or muscle or etc. anything. Kindly don't move and don't disturb it. Some cervical fracture, spine, some back pain fracture, no. The player got paralytic.
sir what should be the difference between R to time sir
What do you really know? Just one player got injured, no. Suddenly he got injured. Don't take immediately. Yeah, understood.
Sir, next first aid class இருக்கு சார்.
வந்துடும்.
அது வந்துரும். ஓகே. இன்னொரு क्वेश्चन இப்போ வந்து இப்போ ஃபிளாட் ஃபுட் சொல்றோம். அது வந்து பாத்தீங்கன்னா நாக்கு, போடி, கருவாக்கு அந்த மாதிரிலாம் இருக்கு. ஃபார் எக்ஸாம்பிள்
This question is very good. Please
ஃபார்
process.
எக்ஸாம்பிள் இப்போ நம்ம வந்து ஃபிளாட் ஃபுட் இருக்குன்னா நம்ம அந்த தண்டவாளத்துல வச்சு ஒரு ரோல் ராட்ல வச்சு இப்படி ரைட் சைடுல நடந்து போனா ஓகே அது வந்து அந்த கரெக்ஷன் பண்ணலாம் சொல்றாங்க. அதுக்கு வந்து டக் வாக் அப்படின்னா ஒரு சாக்கீஸ் இல்லை அந்த தண்டவாளத்துக்கு நடந்து போனா இந்த டக் வாக் இப்படி கரெக்டா ஆகும் அப்படின்னு சொல்றாங்க. அதே மாதிரி போனி அப்படின்னு பாத்தீங்கன்னா அந்த பாலை போயிட்டு நம்ம இங்கே வச்சுட்டா கரெக்ட் ஆகும். நாக்கினும் போது இங்கே வச்சுட்டா இது ஆட்டோமேட்டிக்காக உள்ள கரெக்ட் ஆகும் சொல்லுது. ஸோ இந்த மாதிரி இப்போ பயோமெக்கானிக்ஸ்ல ஷூஸ் அந்த மாதிரிலாம் வருது. ஸோ அது ஸ்டூடெண்ட்ஸ்க்கு நம்ம வந்து யூஸ் பண்ணலாமா?
இல்ல அதுதான். See, question will be you want to can explain the question.
So his question is problems like knock knees, bow legs.
Actually, we already sir explained everything about the posture, but we need to know about the correction. That is the main workshop concept. So, if we have the flat foot, we can walk on the railway track like this. Okay, it will cure. It's a basic thing. The same thing if we have a duck walk in the chalk piece line or in the track also, we can walk like this. It will cure.
On the line.
And then knock knee. Same knock knee like this. No, if you are holding ball here, football automatically the knee will split. Same if you are a bony, you can keep the ball here. It will come like this. So if you are in advance in biomechanics, what we can do?
Yeah. See, for this question, no, first of all, I'm already told you. First, I told you. The initial stage for the kids. Okay, the bone ossification. Okay, the bone ossification initial stage, we have the measurement. So we have the bone measurement and muscular measurement. For the bow leg, knock knee, flat foot, everything we have measurement. For that, if the range is degree is less, we can do the same correction. What the exercise is telling is like a home remedy. What we are doing in the older days, we can do. What nowadays we are doing is we have some roller, we have some advanced, make very faster. That is a home exercise. Some angles, more than angle goes, we need to go for the surgery. That's a bony correction, we need to go for the surgery. That's the two things difference are there. So surgery we throw. Surgery, non-surgical treatment. What is the non-surgical treatment? Same what you told for arch and all. Why we are putting for a kid's insole now? Combinedly we are doing this all correction exercise. The arch may develop. Okay, but we can't tell 100%. What the percentage 50, 60, 70 will develop. The knock knee and bow leg. And this is the difference from the narrow difference. What I told for leg length, 2 cm leg length, we assess the hip, we do the muscular part, 1 cm will come down. Same the knock knee, bow leg, muscular issues will come, the weakness tight and the range will improve. So we can do in the early stage of the kids. என்ன எக்சர்சைஸ் பண்ணனும் கேக்குறீங்களா
ஹை லெவல்ல போயும்போது நம்ம வந்து அந்த மெஷர்மென்ட்லாம் எடுத்து பண்றது அது
ஓகே
but basically வந்து எங்க கோச்சஸ் பாத்தீங்கன்னா basically they are giving it from 6 7 8 7 to 14 or like some ages. So for them, so basically what are the things they can give?
For this first thing sir, I will suggest kindly in the essay panadi you want to meet on consult.
This is what I mean.
First thing, you don't hesitate, don't take self thing. So I got a case yesterday 3 days back, 7 years old girl knocked me. Okay, so before I start treatment, I have opinion with an orthopedician also, because I have a doubt his degree is more, so we need to go for surgery here, because she is 7 years old. Then we took all X-ray, we have a combined opinion, then we are decided surgery is not required. We will try for a 6-month rehabilitation protocol. If it's everything good, we can go ahead. Otherwise, we have time to do surgery. Otherwise, this is a decision. So first thing is go for a consultant. Check non-surgical. நீங்க வந்து இந்த எக்சர்சைஸ் எல்லாம் நீங்களே கூட பண்ணலாம். நீங்க சொல்ற முன்ன எல்லாம் வீடியோஸ் கிட்ட வாங்கிட்டு நான் ஆட் பண்ணலாம். பட் யூ கேன் மீட் அவுட்.
ஏன்னா இந்த கடலோர பீச்ல போயிட்டு பழம் நோண்டி அந்த போன் இங்க உள்ள இறக்கி விட்டு போட்டு முடிட்டாங்க.
இல்ல what is telling is what is telling is no. If previous days we don't have any surface. So it's right. We don't want to laugh. See, for our children, our children, underprivileged children, some situation we can't spend. On physiotherapist, if you want to be for the rehabilitation protocol, for example, that problem, we need a 30 days treatment, 20,000, 25,000, 30,000, how we can't think. For that suggestion, I'm telling go for a consultant, plan it, get a rehab session, you can do a rehab, you can come for review. This all exercise also, I follow Ayurvedic, Siddha and Ayurvedic for my patients. For internal calcium and vitamins. Understood? It's not joke. Ayurvedic, Siddha, all good. Same, this home remedy exercise also good. You can follow. Other modify panni, people floor kulla, we have modern equipment. See, active stretches we do. What is active stretch? Self-on nama pandradhu vandu it's active stretch. What other people do is the passive stretch. Previously we do active stretch, we say. Now we have vision for stretching. We also can do stretch, vision also can do stretch. Same thing, it's an older technique. You can use like sand puller, like in beach, you can walk. Water we can do. Water therapy is the best therapy to do a rehabilitation, but we can't do in an initial stage. The muscle tone will not do. There will be an intermediate and advanced. That is we call as an assessment. Assessment is very, 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 very important. So you got clear, sir?
What would be a basic treatment during the sports the child gets treatment?
So what is the basic treatment?
During his sports, the child gets treatment.
So what is the treatment aspect?
Basic treatment
On the spot. You don't give me any iron. See, he's asked a good question. No, this player, somebody keeps having a pain in the back foot. That's called Achilles tendon. Back side, you know, this one. So he's asking a good question. So prevent. Now prevent panna solita. I told prevention. So you can after training, no, cool down. I'm telling you, cool down. If the coach plans the training is like high intensity, you will plan for icing. After cool down, this pain can be avoided.
Only through icing.
Only see that is icing not only for that region. I'm telling you that we have a professional team ice bath. So for kids we can't have ice bath. I'm telling you can keep some ice cubes for the kids' thighs, knee, calf, and ankle. Next day, see ice bags in market you can get nowadays 25 rupees, 50 rupees per there. You can get. I suggest for kids also you have a kit bag or like a boxer. Or we have all the equipment for football player, boot, everything. They should maintain their own ice bag with a small cover, possible spray. First aid thing each kit should be. Okay, so that will help more. Okay.
So I observed right. Section D, right? There was one match, football match. So what happened? Team played one match, and after that 30 minutes they get relaxed because there was no other match. And after that again they played the match, and after 2 hours again they played the match. But when they played third match, many players got injured. Yes. So what was the reason? Same day they played 3 matches. Morning they played, after 30 minutes they played, and again in the evening.
All the cause so we need to, for that reason, proper make some hydration and pattern. Relaxation. Then ice bath. Make some ice, stretching. That may help. That should be and proper stage, proper hygiene. That can help. Okay, thank you.
Sir, it was a very wonderful session. We have hope all the coaches have learned so many things. Yes.
So if you want, I don't pick the call, you can WhatsApp me. If you want to take my number, I can replay. Multiple messages I can replay. But don't call.
Okay.
Because I got hypertension. BP or this blood pressure.
Yes, the number.
Enter 999 48 39 729. For your kids, you need doubt, I can help. And for places all over India, I have my friends. I can support you some medical support for kids. So 9948397929, and you can now note my clinic number 91766. If I am not respond, you can respond that number. 91766 39729. This is not a promotion for my clinic. Okay, you don't have to come for my clinic. For kids, any tournaments, small tournaments all over India, if you want to do, tell me in advance things. I can try nearby cities. I can send my juniors. For distance, I can send my friend circles to help them. See, major medical support is required for kids only, not senior teams. There's a protocol like FIFA, all over volleyball, badminton. You can see kids tournament only. We should have an ambulance and doctors there. Okay, thank you.
Thank you.